is Keshi. I'm 24 years old and I live in Brooklyn. I'm originally from Toronto. I have familial dysautonomia. Familial dysautonomia is a rare genetic condition that affects the development of nerve cells in both the autonomic and sensory nervous systems, causing life-threatening medical complications from birth. It is also known as hereditary sensory and autonomic neuropathy type 3.
Hi, I'm Evan. I'm 19 years old and I'm living with familial dysautonomia.
Hi, I'm Sam and I'm 20 years old and I live with familial dysautonomia.
Hi, I'm Michael. I'm 18 and I'm living with FD.
This condition occurs in about 1 out of 3,700 Ashkenazi Jews.
Approximately 1 out of 30 individuals in this population is a carrier for the mutation that causes familial dysautonomia.
Outside the Ashkenazi Jewish population, this condition is very rare.
Familial dysautonomia, or FD, is caused by mutations in a gene called IKBKAP.
The condition is inherited in a recessive manner, meaning all individuals with FD inherited 2 mutated copies of this gene, one from each parent. Interestingly, greater than 99% of affected individuals have the same 2 mutations in the associated gene.
There are certain signs and symptoms that can generally be expected at different life stages for a person who has FD, and there are also a range of ways in which people are affected. Common clinical findings can be put into categories based on the body system involved. There are many clinical findings associated with FD. We'll discuss some of the most striking.
Hi, my name is Steve, and my claim to fame is I'm Scott's dad.
Hi, I'm Scott. I'm in with dysautonomia for 35 years. The autonomic nervous system controls involuntary actions like digestion, breathing, production of tears, regulation of blood pressure, and body temperature. The sensory nervous system controls activities related to your senses such as taste and the perception of pain and temperature. FD affects both of these systems.
In the autonomic system, FD causes abnormalities of blood pressure and pulse regulation, such as orthostatic hypotension. Also, up until about age 6, individuals with FD have respiration features that include breath holding and unresponsiveness to hypercapnia and hypoxia.
He was a breath holder, and that passed. Like, regular kids have the terrible twos, dysautonomia kids, some of them have the breath holding twos. He won the trophy one year for breath holding in the foundation competition.
Symptoms involving the cranial nerves include absence of overflow tears, or alacrima, and depressed corneal reflexes. Corneal abrasions are common, even with the frequent use of artificial tears and other lubricants, and many have found that special lenses that hold saline on the eye during the day are especially beneficial.
Hi, my name is Simi. I am 19 years old.
Hi, I'm David. I'm not 19 years old, and I've been living with familial dysautonomia since she was a baby.
I like to read. I went to the bowling. I like music.
You love music.
Love music. Thank you.
Developmental milestones, such as walking and speech, are usually delayed, although some affected individuals show no signs of developmental delay. About 1/3 of children with FD have learning disabilities, such as a short attention span, that may require special education classes. Infants born with FD usually exhibit a poor suck and swallow. Aspiration pneumonias are common, particularly as a result of drinking. For that reason, many people with FD take no liquids by mouth and instead use G-tubes, which can be life-saving, allowing those with FD to have hydration without endangering their lungs. Even so, pulmonary complications are common. Daily respiratory therapies are especially recommended. As the youngsters transition to adulthood, balance is increasingly compromised. In addition to physical therapy, many use walkers or wheelchairs to get around.
My name is Laurent. I'm Sam's dad.
I'm Sam.
And I'm Robin, Sam's mom.
All the automatic parts of the nervous system that you don't think about work differently. So if you turn on the switch to turn on your car, the windshield wipers go on. If you try to turn on the headlights, the seat goes down. So everything sort of works a little bit differently, and actually every FD kid works a little bit differently. So the parents become sort of the technicians of their own kid. So it's it's just sort of learning to drive a different car.
Hi, I'm Jill, Evan's mom.
And I'm Steve, his dad.
I'm Evan.
I'm Max. I'm Rachel.
There are a lot of things about Evan that are very difficult for him, a lot of things that we take for granted, breathing, swallowing, eyes tearing, that Evan has to accommodate for during the course of the day. So it can be difficult at times, but we've learned to live with it.
I'm Freddi, Michael's mom. To find out that he had FD, we didn't even really know what it meant, but I guess we knew it was permanent, so that was devastating. But at the same time, we felt like maybe now we can help him. After his diagnosis, he gained a lot of weight. He had surgery and had a G-tube put in his stomach, and he stopped having this chronic cough, so he really improved.
My name is Samantha. I'm 26, and I was diagnosed with FD when I was 5 months old. Well, I work at a place called the Lower East Side Girls Club. For fun, I hang out with my friends, watch TV shows and movies, and I go to a place called Daniel's Music Foundation for singing.
My name is Faye. I entered the world of familial dysautonomia, or FD, when my daughter Samantha was born 26 years ago. I'm president of the Dysautonomia Foundation. The Dysautonomia Foundation was founded about 50 years ago by parents of people with FD, which used to be called Riley Day. Since FD was discovered in the 1950s, we've made enormous progress in terms of treatment, in terms of understanding this very complicated disorder, in terms of different kinds of medical protocols. Most of the things that have expanded people's lifespans and quality of life have to do with fairly simple kinds of technologies like feeding tubes, so that people who are taken off liquids to save their lungs are able to get proper nutrition. Or respiratory therapy that helps clear the lungs through more mechanical means.
Someone had made the suggestion, while she was an infant, to go down to FD Day, and that was an eye-opener because we saw for the first time really the spectrum of what folks are dealing with. It's helpful to have a support group. It's helpful to be able to commiserate with folks that are kind of going through, if not identical challenges, similar challenges. And there's always what to talk about.